Now, if you're a social worker and you've been in practice a long time, or you are preparing for your clinical exams, it can be a little overwhelming to know and understand all of the types of therapies that exist. Today, I'm going to help break these down by just looking at a few core elements that you're going to find throughout most therapies. Hello, my name is Dr. Christopher Graham. I'm part of buildtheclinic.com, and our goal is to help build 100,000 profitable and purpose-driven clinicians worldwide. The first thing to consider when you are helping your client choose a type of therapy is the ethical consideration. We, as clinical social workers especially, have an ethical responsibility to help choose evidence-based, applicable, and appropriate therapies for our clients. It's our responsibility to help our clients identify the outcomes that they're looking for and make sure that the treatment is person-centered. We have a responsibility to either provide the best evidence-based practice for that client or refer them out to someone who has the skills, or thirdly, if those first two things are not an option right away, get trained, get some experience in that practice, and get under supervision to help provide those services. I live in a very rural part of the country, so it's hard to find other male LCSWs in our community. That means that for a very niche population, I might be the only option. It's my responsibility to either refer or to get comfortable in a practice. Accountability is not your enemy. In fact, that's why we're here. We're all trying to build a community of clinicians so that even beyond your practice tests, even beyond your clinical exams, you have support with a tribe of people that are looking for your success. The second thing to consider is what type of therapy are you looking for? Whether it's on your clinical exams or it's in your practice, we want to understand the components of therapies so that we know what types of outcomes we might achieve with those therapies. That was a really confusing way of saying that you want to know what works and why it works. Here's the way that I break this down. Most therapies can focus on 4 dimensions: cognition, or the way that you think; behaviors, what you do; emotions, what you're feeling; or 4, all of the above. I know that most therapies will probably trickle into every category, but typically there's a dominant focus in mind. If I was to summarize cognitive behavioral therapy, I would do it in such a way that it would just focus on thoughts drive behaviors, behaviors drive emotions, and emotions are great motivators that drive outcomes. There are a ton of therapies that are built around CBT with that simple construct in mind. The way that you think about yourself and or the world around you drives how you behave, which influences what you feel, and that can change the outcomes. That's cognitive behavioral therapy in a nutshell. Dialectical behavioral therapy is a behavior-focused model. However, there are thinking elements because dialectical means that you're holding 2 opposing ideas in one place. For example, a person might feel like they're not good enough, but then feel completely competent and capable. And the mind is struggling, the behaviors are struggling with how to reconcile both of those things. That's why you have tactics like mindfulness and radical acceptance, grounding techniques to help ground you in reality while you still deal with what's going on internally. You can take this idea and broaden it across any type of therapies. Cognitive processing therapy, acceptance and commitment therapy, narrative therapy, solutions-focused brief intervention, motivational interviewing, they all focus on one of those things primarily or all of those things. Here's the point. As you're preparing for your clinical exams, don't memorize all of the types of therapies. You need to understand how to apply those therapies. The exam is not trying to trick you, and it's not trying to determine whether you memorized every single type of treatment that exists. The truth is that while we're in clinical practice, you're not going to know all of the things. You don't have all of the answers. Ask my wife, she'll tell you, I don't have all of the answers. The point is not that you know the answers, but that you know where to find the answers. Remember, you only need a 70% on the test. That means that they're trying to find the average answer across clinicians. As you're in practice, as you're building your practice, be open to other types of therapy. Get trained in things that you don't understand. Get supervision for techniques that are unique to needs in your area that might fit really well. Number 3, figure it out. No one has all of the answers, so go find the information that's going to be meaningful to your clients. For example, this book right here is one of the best resources for helping to find what types of techniques work for your clients. We have to give diagnoses, so we want to make sure that the treatments we're providing are ethical and meaningful for our clients. If you're not able to provide a service, refer out or get trained. The 4th thing that I would encourage is to build a library of resources. You don't have to do this on your own. Find books, find materials that can explain therapies and treatment in a way that you understand. If you are not sure about how to use a treatment or what it might be useful for your clients, read a little bit about it and then go on YouTube and find a video of someone practicing the technique. If you think it could work for your clients, then go get trained in it, go get some supervision in it, go get some experience in it, and start using it in your practice. As always, we're here to support you. You're part of the community. Good luck. You've got this.